preparing live stream. And then when it's prepared, we're actually live.
When it's prepared, then it's going to, you will see you probably see like a share.
Yep.
Like a share. You can click on that to get the URL. And then do we have a way to broadcast that? We have that too.
Oh, only one host. It says only one. I'm going to do all panelists because somehow it's not letting me. Okay, let me show you what I see. Okay, so this is what's here. Okay, so it's, I don't see the share. Oh, there it is.
Yeah.
Share.
So you can copy that.
Okay. So, John, there is the link to the YouTube in the chat. And so we will, we can put that onto, now folks in, if we're telling people about it, we can put that in the chat. And then I think we can also send that out with, can we send that out with a reminder, like a text, or put on our webpage or something? I know it might be a little bit late.
I can text people right now if you want.
Okay. And then, yes, Ryan is going, if you can also give that to Ryan Phillips. He's the one, I see your chat, Josh, going to be monitoring the YouTube, and he'll send us trends of questions. I don't think I gave Ryan access to this, should, like a panelist. Because he'll be on YouTube. Okay.
So just so you know, we are live on YouTube right now.
Yeah. Nobody has a link yet, but yeah. That was really quick. Sometimes it says it to do it, which that it takes a while. So yeah, Estelja, I don't know if you want to just project the screen, so at least you know we're talking, but at least if somebody does get on, they see welcome back as something. Okay.
Josh, does that look okay on YouTube if you're looking there right now?
Let's see. Can y'all hear me?
Yeah.
So there's like a 30-second delay, minute delay. So I just saw you ask me, Salja, does it look okay on YouTube? Like just now. Yeah, I mean, you can see the same thing. You can see all of your tabs and stuff. So, you know, if you don't want them to see that, then, you know, you may want to pull out that tab and just share that window. But other than that, it looks, you know, you see folks in the upper right-hand corner, and you know, it looks solid.
And to be clear, YouTube has no translation, correct? Okay.
That is correct.
Okay. I'm just getting Barb and Mara. Anything else we want to walk through? Just a reminder, so I'll open it and then do the instructions. We'll probably start, let's see how many people jump on. Sal, did you want to share the deck? Do we want to give them the access to the deck? So maybe we can get that ready too, to just paste. And since you're going to be posting, if you put it in the chat, I can repaste it over and over, you know, like as they, well, I guess this is, yeah, like as people come on. Okay. And then I'll wait a little while. We'll give instructions about we'll get the interpretation set up first. Then we give instructions that we use Q&A instead of chat. And we'll also mention the YouTube. Anything else anybody wants to point out, or?
Hey, I'm not certain I got the answer to this earlier. What do we say about sports with regard to like, you know, heavy contact sports? And what do we say about music, you know, wind instruments, singing, etc.?
Yeah. So for both of those things right now, we're planning on continuing following CDPH guidelines, which means wearing masks for high contact sports. And then we're also offering testing to all of our student athletes, and we were doing vaccine outreach with them over the summer. For music, we're looking at some of the national standards that exist around music safety, but we're also waiting because CDPH is supposed to issue their music guidance this coming week.
But any plans to like do music outside?
Yeah, I mean, I think that's what it'll ultimately come down to, but we want to wait on like issuing our own guidance. And then, you know, the state says, actually don't do music at all. We want to make sure that it's in line with what the state says.
And I thought that there was a move towards like requiring everybody who wants to do like football to be vaccinated.
Yeah, I mean, that is a recommendation to like you can get vaccinated or you can not do sports in the red tier. I think the like vaccine mandates will likely depend on what happens probably over the next couple of weeks in California, both in terms of state guidelines and other local districts making decisions around vaccines, not just really for sports, but even more widely for different categories of both staff and students.
Gotcha.
And I don't see Gary Middleton. Is he coming?
Yeah, I think he said he was going to. I can text him now.
Maybe on his way. I want to make sure I sent the right email. He perhaps could be in the attendee too.
Yeah.
Okay, we have 1 minute.
Sandra, just so that you know, the kind of framing for this at the beginning is just talking about that we are, you know, coming back to full-time in-person instruction. The restorative restart is like our framework for how we're coming back. So I'm just going to say like, this is what those 5 areas are, and just really briefly frame this within the context of that. And there are going to be undoubtedly independent study questions that come up here. And so I'm going to say like that is not what the space is for. And Gary is planning an independent study info session webinar for next week. So we're going to try and divert those questions there. But it's possible that people will have some questions about the restorative restart that I may not have the answer to. So thank you.
All right, everybody, here we go. Welcome, community, to our 2021 Restorative Start Family Welcome Night. We're going to give a moment for folks to log on, and then we will get started. And good evening. Welcome to everybody joining us. My name is Jody Talkington from the Superintendent Office. I'll be supporting facilitation, and we will get started in a minute as we allow more folks to log on. If you're just logging on, I want to say welcome to you. My name is Jody Talkington. I'll be supporting the facilitation tonight. We have lots of staff here, and we are going to have interpreters and moments for all parents and families and community to ask questions. We'll wait one more minute to get started to allow folks to join. All right, welcome everybody. Again, if you just joined, my name is Jody Talkington, and I'll be helping to facilitate tonight. Welcome to our family Welcome Back to School 2021 Restorative Start. I'm going to start with a few logistics. First, we will be using the Q&A function tonight instead of chat, so you can put your questions and comments there. Secondly, we have capacity for 1,000 people to join this webinar tonight, and we also have a YouTube link that will be put in the chat shortly, so you can see that. We may ask those of you who don't need interpretation to move to the YouTube link if we reach capacity. Next slide, please. Before we get into the content for this evening and hear your questions and comments, we'd like to set up our interpreters. And so I'm going to take a moment to allow them to give instructions for interpretation and for us to see who needs interpretation, and then we will continue. So welcome if you're just joining. Let me move to Andres. Can you give instructions in Spanish, please?
Yes, absolutely. Thank you. Thank you, Mr. Quintal. Buenas tardes, mi nombre es Andrés de la Torre, yo voy a ser su traductor de español el día de hoy. Las personas que necesiten traducción en español, una vez que activen el sistema, van a ver lo que está en el circulito rojo, dice Interpretation. Eso lo van a ver en su pantalla cuando lo activen, en la parte de abajo de su pantalla. Cuando lo activen, ustedes van a darle clic ahí y van a escoger español. Solamente ustedes me van a escuchar en español. Si tienen alguna pregunta o alguna pregunta, algo que comentar, lo tienen que hacer donde dice Q y A. No lo pueden hacer en el chat va a estar desactivado. Donde dice Q y A, ahí pueden poner sus preguntas. Las personas que están accesando a través de un celular, por favor, en el celular hay 3 puntitos. Ahí apachurren los 3 puntitos, van a salir las mismas instrucciones y les pedimos que si pueden bajar el volumen para que puedan escuchar, porque luego creo que hay conflicto con el sonido, pero sí pueden escuchar bien. Entonces recuerden, las preguntas y respuestas es lo que van a usar, no van a usar el chat. Entonces de rato van a activar, una vez que acaben mis compañeros, van a activar el sistema de interpretación. Gracias. Okay, I'm done.
Thank you. And for those who are just joining us, thanks for coming to our family Welcome Back night on returning to school. And we are just giving instructions for interpretation. So Carmen, can you give instructions in Mum for us, please?
Hello, buenas tardes. Chunta chimach uli halen donta juntalo. Arco mat a tokiol mum. Entonces, ya llega ni cartal Zoom, pero se toma ni instrucciones al llega ni cartal. Ha toca juntos, ha toca un cierto interpretation ko katbe ik how to jig hash ni kahyol toka in ok tatbe li timam entonces toka in kahyol mam ده فعل الأتاهي كورت أون هون بريغونتي ما هون كومنتاري لاي كورت أون تي توخ chat خط كورت أون تي توخ كوتي إيش هاشات توخ تلفن وما تأكشي إنتو إيدي أت أوش بونت كاوتشي كهاش تو ستيك بانتاي كوكو تتباقي هاش كشاية توني تو interpretation كود سكيول دي خيول مام تونس توخ تبين خي توخ خيول شون تجي. Thank you.
Thank you. And for those who just joined, welcome to our Family Back to School information session tonight. And we're just giving instructions and interpretation. David, could you give us instructions in Chinese, please?
Sure. 大家好，歡迎你嚟到開學前嘅諮詢會議。如果你需要廣東話嘅翻譯，請點擊屏幕下面控制鍵嘅地球嘅圖案，之後喺菜單上選擇 Chinese 中文，你就可以收聽到廣東話嘅翻譯。我哋宣佈咗之後咧，就會見到個地球形狀㗎啦。咁咧今日咧就係唔會用個 chat 去，如果你有啲問題咧，請你將你嘅問題或者嘅意見咧係用 Q&A 個功能。今日我哋係會刪咗個 chat 嘅。多謝 ，I'm done.
Thank you. And Mariam, can you give instructions in Arabic, please?
السلام عليكم ورحمة الله وبركاته. مساء الخير في اجتماع العودة إلى المدارس. للحصول إلى الاستماع إلى الترجمة باللغة العربية الرجاء اتباع التعليمات والإرشادات. في أسفل الشاشة هناك خاصية على شكل الكرة الأرضية، اضغط عليها ثم على كلمة الترجمة ثم اختار اللغة العربية. إذا لا ترى هذه الخاصية وتستخدم جهازك النقال، على يمين أسفل الشاشة عند كلمة مور اضغط عليها ثم اختار اللغة العربية. الرجاء كتم الصوت الأصلي حتى تتمكن الاستماع إلينا بطريقة واضحة. وشكرا. Thank you.
Thank you. And welcome everybody who's just joining us. We're finishing our interpretation instructions. And then
the Vietnamese?
Yeah, so the last one, Vietnamese. Go ahead, Vinh Kim.
Xin chào quý vị đã có mặt ngày hôm nay. Đây là một buổi họp về bàn về chuyện mà sẽ trở lại trường học, và cô Jody Tuckington sẽ là người điều học viên ngày hôm nay. Trước nhất xin quý vị nhìn vào phía góc ở bên phải mà có những cái ký hiệu, nó có cái ký hiệu như quả cầu, nó để cái chữ là interpretation. Quý vị nhấn vào đó và quý vị sẽ thấy có cái dò xuống sẽ thấy cái phần tiếng Việt. Thì quý vị hãy nhấn vào cái phần tiếng Việt đó thì sẽ nghe được tôi thông dịch. Còn nếu quý vị dùng qua phone mà không thấy cái hình quả cầu này thì nhấn vào 3 cái dấu chấm. Thì khi mà nhấn vào 3 cái dấu chấm thì quý vị cũng sẽ có cái phần là quản lý ngôn ngữ mà thông dịch đó, Manage Language Interpretation, thì quý vị cũng nhấn vào đó và sẽ dò tìm vào cái phần tiếng Việt thì nhấn vào đó và sau đó quý vị chỉ cần nhấn vào cái chữ done là xong. Thì nếu những ai không cần mà có thể hiểu được tiếng Anh mà không cần phải nghe thông dịch thì quý vị có thể theo dõi cái phần thuyết trình ngày hôm nay ở trên cái đường dẫn YouTube. Ở trên cái đường dẫn YouTube nó có trên cái phần chat. Và phần thứ hai nữa là nếu quý vị đặt câu hỏi xin vào cái phần mà Q&A là question and answer, là đặt câu hỏi chứ đừng đánh vào cái phần chat, tại vì phần chat sẽ không có hiện lên. Nếu quý vị có thắc mắc gì thì cứ hỏi tôi là Vinh Vũ, người thông dịch qua cái đường mà thông dịch. Một lần nữa thì là có cái phần Q&A là để quý vị đánh vào câu hỏi. Xin cảm ơn. I finish.
Great, thank you everyone. So again, welcome to our Family Back to School night. Thank you for everybody for joining us. My name is Jody Talkington. I'll be supporting facilitation tonight. And just a couple logistics. Remember, we are using the Q&A function instead of chat. That's where you can put all your questions and comments as you're part of the meeting tonight. We will pause a few times throughout the presentation to take questions and comments instead of waiting till the end. But you can also type in as you're listening. And with that, in addition, we have up to 1,000 capacity for our participants in the meeting tonight. We're still within that capacity, but if we do reach that, we have an alternate option of joining YouTube Live. And so we'll put those links in the chat or so you can access them. And we will also put the link to the presentation so you have that information as well. So next slide. And at this point, I will turn it over to Salaja Suresh, who is our district COVID lead, to share the agenda and get us started. Thank you.
Thanks, Jody. Good evening, everyone. My name is Salaja Suresh. I'm a senior director with the district in the Chief of Staff office. And I have been working on the COVID response for the district for the past year. And I'm so happy to be with all of you tonight. I know it is a very exciting time. It's a very anxious time as we are preparing to reopen schools and are very excited to be back together, but are also understandably nervous coming out of a very difficult year. So I'm hopeful that tonight and tomorrow night we'll have a chance to just share what our plans are, what we've been working on, and also answer any of the questions that you may have. So again, thank you for spending your evening with us. I appreciate you taking the time to be here and get informed and ask questions that can help us better prepare for having our students back on campus this year. So our agenda for tonight, I'm going to start by just framing the context of how we are returning to full-time in-person instruction, which is really around a restorative restart for our students, for our young people, as well as our staff coming back on campus, many of them for the first time in more than a year, and how we are attending to their needs in that transition back to full-time in-person instruction. I know that there are many of you that probably have questions about independent study or distance learning. Tonight is not the forum to get all of those questions answered. We will be scheduling another info session next week, specifically with the team that's managing our Sojourner Truth program, which is for independent study. And so I ask if that's a big focus for you and something that you want questions answered about. We will be sharing out that time and date and that link for next week to answer all of your questions about distance learning and the virtual academy option. So the restorative restart, again, is focusing on our in-person return, and then we'll be getting into some of the details around the COVID-specific guidance from the State Public Health Department as well as the CDC. I will say the other thing about the content of this presentation is that these guidelines are constantly changing, that even just as of a few minutes ago, the state, the county, the CDC are constantly revising their guidance as they are responding to real-time conditions. And so just know that as we are telling you what we are preparing for and what we are expecting to do, that will continue to also evolve as the state guidance comes down to us. So just be aware of that. And if we do make changes from where our guidance is right now, we will also communicate that back out. So to start, focusing on the restorative restart, we know that this was an incredibly challenging past year and a half for everyone in our community, for students, for caregivers, for educators. It was a lot of new things all at once. A lot of us have been personally affected by COVID-19, either ourselves or our family members or our loved ones. And we know that there is a lot of care and attention that will be needed for our young people to help bring them back into our school buildings with a lot of love and attention and support to make sure that they can be successful this coming year. And so our restorative restart is framed around these 5 priorities that really came from feedback from the community around what was important to them for us to pay attention to in this new school year, which is, really centering around relationships, making sure that we're addressing the whole child need, making sure that we're empowering teams at school sites to really reimagine and rebuild systems in service of young people, making our teaching and learning relevant to our young people, rigorous, given the need for accelerating learning this year, and to make sure that we're really working with our community to strengthen the staffing that we have available at sites and our partnerships in the community as well. So I'm not going to go too in depth into each of these areas, but just know that some of the ways in which this will show up at our schools is, expanding home visits. We did thousands of virtual home visits last year, and it was a very successful way to build bridges between families and the school site. That's something that we will continue to do this year, as well as just build on all of the different types of ways to create those relationships with our families and with our school sites, knowing that, again, it's been a year and a half since we've all been together, and we have many new families in the system, and we want to make sure that we're establishing those relationships this year. Really paying attention to addressing the whole child needs. We know that if a child is hungry, if their mental health needs are not attended to, if there are things that they need at home, then it will be really challenging for that child to be successful academically. And so we're really strengthening a lot of our work around mental health, around supporting students in accelerating their learning, in making sure that we have individualized learning plans for our students, and that we're creating spaces for students in racial affinity groups to support each other, learn from each other, and help ease this transition back into in-person learning. And of course, focusing on our staff and making sure that we have a way to do all of these things, that we have the right staff to provide additional tutoring, to provide those mental health supports, to make sure that we're expanding learning opportunities outside of the school day. So after school programs, Saturday school, other kinds of activities where students can catch up and accelerate their learning this year. As well as supporting with attendance and norming people with coming back to school every day. And then, of course, the content of what we're teaching, right? Making sure that what we are teaching is engaging to students, it's rigorous, it's preparing them for college and career, and it is culturally responsive. And so a lot of the professional development that's being provided, the curricular resources we're purchasing is with this in mind. And then finally, just the last thing, really trying to create space for school teams and then cross-departmental teams in the district to think about how we are redesigning our systems in service of our young people at this particular moment in time, right? It's such a profound moment of transition for all of us that we want to make sure that we're really there for our students and designing systems that are not just replicating what we have had in place in the past, but that are really appropriate for who we are serving and what we are trying to do for this moment in time. So with that, I'm going to pause before we transition to the next section, which is going to focus on the COVID guidelines from the state and the CDC to see if there are any questions.
Thank you, Salaja. So I'm going to pull out a few trends that I see in the Q&A, and I see I'll be able to take a few raised hands as well. I see some folks raising their hands. So there are quite a few questions about if vaccines will be mandatory for our teaching staff. Why or why not? Or will they, if not mandatory vaccines, will they be regular testing? And then another related one is the vaccine status of district staff public?
Mm-hmm. Yeah. So as of right now, we're following the state guidance, which is to say we are very strongly encouraging the vaccine. It is not currently a mandate, but we are running vaccine pop-ups at multiple school site locations. We've been doing that over the summer. We're going to continue to do that in the fall. We are not going to be releasing the private health information of our staff members, which is to say we're not releasing information about vaccine status. That being said, as I said at the beginning, things are constantly changing. And so just know that the guidelines that we are talking about today may be different than the decisions and the guidelines that are coming from the state, the county, and the CDC tomorrow or next week or next month. But as of right now, no, the vaccine is not mandated, but it is very strongly encouraged for all of our staff as well as our students ages 12 and up. And we're hosting pop-ups in as many locations as we can to try and provide access.
Okay, thank you. There's also a question about, I know some of these you might get to, so let me know, but there's some questions about school lunch protocols and whether students will be eating outside. When students are outside, do they need to be masks if they're outside for other reasons too, gym or music or anything like that?
Yeah, so I'll get a little bit more into the specifics of the guidance in the next section. So why don't we move there next, and we'll specifically talk about lunch and masking as well. And so with that, I'm going to invite up Dr. Emily Frank, who has been supporting us as a part of a team of UCSF physicians over the past year around COVID guidance and interpreting what we need to do to keep our staff and students safe. Dr. Frank?
And actually, Sailaja, did you want to talk about this slide here?
Sure, why don't I do that? So before I bring up Dr. Frank, I just want to situate what we're going to be talking about, which is to say our strategy around the COVID response over the past year. This has been the same, which is to say that we start by looking at the science and what does the scientific literature say over the course of the past year about how to reopen schools safely? And then we look at the public health guidance and what are we doing to ensure the safety of our staff and our students? And then what systems are we putting in place? What documents are we making available? What training are we providing to support our staff in going back to school campuses? And then how are we keeping student learning at the center of that to make sure that all of these things are really working in concert to make sure that our students have access to the best learning experience we can possibly provide them. And then just a high-level overview of some of what we've learned from the CDC. They've done a really excellent job of compiling the research that was done around the world with school reopenings. As we know, last year, everyone kind of did something different in different countries, in different states, even across California. Every district really had a different timeline and a different approach to reopening around the country. And because of that, it actually provided a lot of data to researchers to really understand what worked in school reopenings in order to keep students safe and to keep staff safe. And so here were some of the lessons that they really learned. So one is that masks were incredibly effective, that they found that in-school transmission was really only happening where prevention strategies like masks were not being used. The other thing that was found that was true here in Oakland as well was that in-school transmission was low, that when school communities did open around the country, they didn't see a corresponding spike in that county's COVID-19 hospitalization rates. So that was our experience as well, that when we reopened partially in the spring, we didn't have any cases of in-school, in-class transmission for the cases that we did see amongst our staff and amongst our students. Also, generally thinking about our younger students, that rates amongst young children remained low, that more frequently they were finding that staff-to-staff transmission was a more common occurrence than transmission to or from students, and that the rates of COVID transmission was generally lower amongst our younger children as opposed to our older children and our staff members. So with that, I will pass it off to Dr. Frank.
Great. All right, thank you, and good evening, everyone. When I last had the chance to speak with many of you during the spring, we knew a number of steps that we could take to create a safer space, but we didn't have as much information about the weight of different layers that could be taken. And so this slide here reminds us that there are many layers of protection that can be implemented to keep school communities, so kids, staff, families all safe. And so when I showed this model to you in the past, I used Swiss cheese, and I had a bunch of things all lined up. And I've kind of flipped this on its side to try to show what we know about different layers of safety. And so on the top, I have these particles to represent viruses, and how, when there's virus circulating in the community, how do we make sure that it doesn't trickle down? And how do we put as many safeguards in place as we can? And so one of the really big differences between now and 6 months ago is we have available widespread vaccination. Now, of course, this is only available for individuals 12 and up at this time. Hopefully there will be approval for younger folks coming out either late this fall or early winter. But what we know is vaccination, and I'll talk more about vaccination in a minute, is a very helpful tool for reducing rates of transmission. Additionally, as Salaja mentioned, we've learned that masking is really, really helpful. And in schools where masking is universally implemented, it is really helpful for decreasing in-school transmission. On top of these two really important layers, there's other steps, other layers that we can take to help keep schools as safe as possible. And so a big one of those is staying home if sick, or if a person's having any new symptoms. We can also maximize ventilation. And while this can involve, air filters or updating HVAC systems, it can also include things like having class outside, or opening the window, or opening the doors of the classroom. Another layer to help keep us safe is implementing distancing when masks are not on. So for example, in settings, maybe if students are outside or eating lunch, those are times where we can make sure to reduce risk by increasing the distance between individuals. And then finally, testing and contact tracing continue to be an important layer in helping to keep communities as safe as possible. No one layer is perfect. No one layer is 100%. But when we stack these different layers of protection on top of each other, we can really significantly reduce the risk of transmission. Next slide, please. So a couple comments on vaccination. So right now there are 3 vaccines available and authorized in the US. So Pfizer, Moderna, and Johnson & Johnson. And currently one is approved for individuals age 12 and up, and that's Pfizer. And what we know about these vaccines is that they are very effective in preventing serious illness, meaning COVID that requires hospitalization, and very effective in preventing death from COVID. So a few weeks ago, the CDC announced that of the people who were getting hospitalized for COVID, 97% of them had not been vaccinated. So at this point, the vast majority of people who are getting seriously ill from COVID, ill to the point of needing hospitalization, have not been vaccinated. At the same time, they reported that 99.5% of people who were dying from COVID had not been vaccinated. Those who were vaccinated and dying from COVID tended to be very old and tended to have underlying conditions. And so vaccination is really an incredible tool for us to help reduce serious illness and death from COVID. It can also help reduce getting COVID at all and minimize symptoms. They're doing studies right now to try to understand if it can also reduce the risk of long COVID. We don't really have an answer to that yet. But when adults and when children over 12 get vaccinated, it helps provide protection to those who cannot get vaccinated. So those who are under 12 or those who perhaps cannot mount an immune response to the vaccine. And this happens by decreasing community levels. Next slide, please. Another thing we've learned is that masking is really important. And as you've likely heard in the news lately, there's been a real increase in the push to mask indoors. Why? Well, when everyone masks, we're helping to protect both people who are vaccinated and people who are unvaccinated in the community. And I actually saw a question earlier in the chat that I want to incorporate into this. So in earlier variants of COVID, so for example, the Alpha variant, what they found is that, can you go back, please? What they found in earlier variants is that people who were vaccinated weren't carrying a lot of virus. And because they weren't carrying a lot of virus, they weren't as likely to transmit the virus. And what's come out very recently, and data is still coming out about this, but what it looks like is that with Delta, people who've been vaccinated may not get sick from COVID, but they may have virus in their nose that could be spread. And so that's where this recommendation for masking indoors has come from, is because there is thought to now be more of a risk for those who are vaccinated to be able to spread. The encouragement in many places and mandates in others has been related to masking. So I'd seen that was a question earlier and figured I would just address it now. Next slide, please. Another really important way to help keep our community as safe as possible is to be really vigilant about symptoms. And really, for any new or different symptoms, it's going to be important to stay home and get tested, even if you've been vaccinated. And so I want to remind us that in anyone, the symptoms of COVID can be variable, but especially in kids, COVID doesn't always look like a fever or a cough or body aches. Sometimes it can be a headache. Sometimes it can be a sore throat. Sometimes it can be nausea or vomiting. And so this year, especially, it's important to be vigilant of these symptoms. If you have them, stay home, get tested, and look to guidance from your healthcare professional.
Great. Thank you so much, Dr. Frank. We'll pause there. And Jody, if you want to raise up any additional questions for Dr. Frank before we move on to the guidance.
Yes, thank you, Selja. Thank you, Dr. Frank. There's quite a few questions about information, perhaps updated information from these studies you have, or any current information you have about the increase in the Delta variant and what recommendations we are doing for the district and that you recommend for distancing or masking given that increase in the variant, even if it isn't necessarily in the state guidance.
These are great questions. And I want to first remind us that our knowledge about Delta is increasing every day. And so I get, 5 or 6 medical notifications a day with updates about Delta. So we're still learning. What we know about Delta is it's more easily transmitted. The good news is the same actions that have helped prevent previous cases of COVID are so far helpful in preventing Delta as well. So masks continue to have a very important role. Isolating when sick, testing, contact tracing, all of those play a role. One thing I want to make you aware of is a couple things I want to make you aware of. So one thing that we're seeing, which we expected to see, is that a greater proportion of those who are sick are children. This makes sense because children under 12 aren't getting vaccinated. People over 12 are getting vaccinated. And so because of that, proportionally, fewer of them are getting COVID. And it looks like it looks as though it's shifting, but that shift is happening because adults and people over 12 are getting vaccinated. In terms of seriousness of COVID and transmissibility in young people, right now it looks like the Delta is about twice as transmissible in children as previous versions. And I'm actually not sure how that compares with adult transmissibility, but we know Delta is transmissible. And we've learned our lessons from earlier this year about, in general, what we can do to reduce COVID transmission. And that's not particularly different with Delta, with the exception of masking indoors, as I brought up. And that's because we're learning that people who are vaccinated can still carry a higher viral load of Delta. And we think potentially it could be transmissible. So that's the main difference that's come up so far in terms of prevention. I suspect another question is, does Delta appear to be more serious? And we don't actually have an answer to that yet. Like, there's no clear information from the studies about whether Delta causes more serious illness. I haven't seen sort of like blatantly that has. I think those studies are ongoing. What we know right now is that it's more transmissible, meaning more easily spread than earlier versions.
Great, thank you. One more question. There's a lot of questions about our protocols for OUSD, which we'll get to the next session, but one for you, Dr. Frank. If an unvaccinated child tests positive for COVID, how long should they wait before getting the vaccine? And how, of course, if they're eligible for it, and how effective are the natural antibodies from viral exposure compared to vaccine-induced antibodies, and for how long are they effective?
Those are such good questions. I'm sorry, Jody, can you remind me of the first one again?
Sure. It is, if an unvaccinated child tests positive for COVID, how long should they wait before getting it?
So generally about 2 to 3 weeks, but my recommendation would be to check in with your primary care provider, because as we've mentioned, lots of guidance is changing frequently, but generally 2 to 3 weeks after resolution of COVID, it is safe to get vaccinated. And we encourage those who have had COVID to still get vaccinated. This is because it is not clear how strong immunity from prior COVID is and how long it lasts for. So someone asked both of those questions, and we're still researching this. I don't have a concrete answer for you on this yet. We're continually working to figure it out. But one important point is that COVID is changing and COVID is mutating. And so if somebody had COVID a year ago, the version circulating now may be different than before. And so all of that to say, like, it is at this point, I would recommend getting a COVID vaccine, even if you have had COVID before, to ensure that your immune system is as ready as possible to respond to the COVID in circulation right now.
Okay, let's take one more question for the doctor, and then I see lots of questions about our own protocols, so we'll move to that next. Does the prognosis for young people and kids change with the Delta variant? And you may have answered that a little bit, but if you could just address it again.
Yeah, we don't know. We haven't seen evidence of that yet. But Delta has only been widely in circulation in the US for 6 to 8 weeks, I would say. We haven't seen that in Britain or in Europe or in other areas of the world where Delta has been in circulation for longer, but that's information that isn't yet available to us and hopefully will become clearer with time.
Great, thank you. And if you can stay on or support in typing some of the answers in the Q&A, that would be helpful. So folks, if you have more questions for the doctor, we will be able to get to those either by typing the answers or saying them out loud. We know a lot of folks are watching on YouTube, so we'll be sure to say answers out loud as well. But at this point, I will pass it to Selja so we can get to many of the questions about the protocols we're doing for OUSD, given this information, like our testing, screening, cleaning, those kinds of questions. I see a lot coming up. So Selja, back to you.
Yep, great. Thank you, Jody, and thank you, Dr. Frank, as well. So I'm going to start with just high-level priorities that came from the CDC as well as from the California Department of Public Health of how they kind of wrote the guidelines for school districts to follow this year. So really the intent is how to maximize access to full-time in-person instruction while also providing these multiple layers of protection against COVID. So really encouraging vaccines for all eligible individuals, requiring masks for all staff and students indoors, encouraging improved ventilation. And I'll be talking a little bit more about the investments we've made in that area across the district. Really stressing the importance of keeping symptomatic individuals off campus. As Dr. Frank mentioned, if you're having any new or different symptoms that might be related to COVID, it's really important to not come to school that day. Continuing with the washing and the sanitizing of hands, which of course is preventative against other viruses that we have in circulation, the flu, colds, that it's important to just try and keep everyone as well, as safe, as healthy as possible. Investing in contact tracing and ensuring that we're quarantining appropriately when there is a positive case and when we do have prolonged close contacts. And then also really investing in a testing program. And I'll get into details about each of these just now. So starting with the masking guidance. So masks are required for everyone, all staff, all students, ages 2 and up, regardless of vaccination status. So even if you are vaccinated, we will be asking you to mask up. I know that there are other places around the country that are considering masking guidance outdoors as well. We are certainly not discouraging wearing masks if you are outdoors, but it is absolutely a mandate for when individuals are indoors. And then in terms of ventilation, this is definitely one of the areas that we have spent a lot of time and a lot of energy improving our ventilation across schools, across the district. And we've been really fortunate to have a partnership with the Lawrence Berkeley Labs at UC Berkeley and the indoor air quality engineering team there, where they were really able to support and advise us about what to invest in to improve our ventilation systems, so that we were, again, following the science to make sure that the ventilation investments we were making were actually the ones that could provide an added layer of safety against COVID-19 transmission. So starting back in the spring, we ensured that all of our classrooms had been set up with portable HEPA air purifiers. And this is a picture of one of the models that we purchased, which again was recommended by the indoor air quality team at LBL. We have also upgraded all of our built-in HVAC systems. So these are the systems that have normally been running at school sites, but we upgraded the filters to the highest standard that is available, which are MERV 16 filters. The CDC and other national organizations have set the standard at MERV 13, which is kind of 3 grades below what we invested in, because we knew that the health and safety of our staff and our students was such a priority in our community. It was important for us to purchase the best filters that were available for our staff and our students. We're also going to be outfitting cafeterias and gym spaces with some large fans to assist with the indoor-outdoor air circulation. So another really key strategy around ventilation is improving the air exchange to ensure that fresh air, outdoor air is coming into the classroom, the cafeteria, the space that is being used, which can happen obviously by opening a window or opening a door, but adding a fan that brings that new air in is an added layer of protection, particularly for our large spaces. I know that earlier there were questions about cafeteria spaces and what we're doing to keep kids safe while they're eating. So again, we are following the guidance of our public health officials. As a school district, we are really focused on how are we educating the children and are trusting our public health officials to guide us in terms of the safety guidelines. And, and for lunches, for eating on campus, the guidance is generally, we are going back to school. Students should have access to food in the cafeteria. It's okay if they eat indoors. And then we're doing what we can to add layers of protection onto that normal lunchtime scene, where we're encouraging whenever possible that students be seated with their classroom. For example, at elementary school, you stay with your third grade class. We're adding the fans to improve the indoor-outdoor air circulation. We're requiring that students wear their masks while they're in line and getting food, and only taking them off for when they need to eat. We're encouraging in terms of scheduling, making it so that that portion of time actually spent in the cafeteria eating is reduced as much as possible. And then we're also seeing whenever possible how to create opportunities for more distancing, for more staggering, for more eating outdoors, depending on the layout of the campus. But again, we're trying to adhere as closely as possible to the state guidelines around this, which is that students can definitely eat indoors, and that you just provide as many mitigation measures as possible to ensure that that eating time is as safe as possible. I also want to speak to a minute about our testing program. So as the largest school district in Alameda County, we have very much been on the forefront of designing a testing program. And that's true not just in Alameda County, but really across the state. And so again, we're following the state guidance around recommending testing for symptomatic persons, that is regardless of vaccination status. If you are feeling a symptom that may be COVID, we encourage you to get tested. We are then also recommending testing for individuals who are in prolonged close contact with a COVID positive person, and also unvaccinated individuals, to ensure that those folks have access to testing every week or multiple times a week. And again, those guidelines come from the state guidance, as these are the individuals who are obviously at highest risk, and we want to make sure that they have regular access to testing so that they know if they are positive. And in terms of how we are providing that testing, we're really trying to make access to testing as easy as possible for our families across the city. So we're starting with our 10 regional testing locations. So here's a map where you can see the colored pins of where our testing locations are. We're offering both rapid antigen testing, so you find out right away, as well as PCR tests. And the reason we're providing both is because, ease of mind, it's really important to know right away, like, had symptoms, is this COVID? But we also want to make sure that we're using the more sensitive PCR tests in case a person is, asymptomatic or has a very, very low viral load, that the PCR test is a backup to the rapid antigen test, and also so that we can send those results to the state lab for processing. And that actually helps them in terms of their work as the public health department in tracking mutations of the virus, the different variants. So that's critical information for them to have. We're also investing in rapid response teams, and this is in partnership with the state. So if there is a positive case at any school, we will deploy the rapid response team to provide testing on site. So if we find out on a Wednesday afternoon that there was a positive case at a fifth grade classroom at a school site, the next day we will send a rapid response team there to be able to provide testing to the individuals who are in that classroom who might have been in prolonged close contact, but also to anyone else on the school community who's just concerned and wants to have access to tests. And so that's one way in which we're going to be making testing available. But we're also going to be having at every single school site a number of at-home testing kits. And so these are rapid test kits that can be done at home. And the intent is to provide them to staff, to students, to family members who maybe are feeling symptoms and they're not sure if it's COVID and they can't get to one of our regional testing hubs. Or it's someone who was in close contact to another family member or went to a gathering and found out that they were near someone COVID positive outside of the school context, and they're worried and don't know how to get to one of our community testing hubs. We're like, here you go. You have access to a testing kit. It's got 2 tests in it. You can test yourself over a series of days, just to, again, provide some of that peace of mind and make it as easy as possible. We want to have as few barriers as possible when it comes to accessing testing. So those are some of our guidelines and procedures around testing. The signups are available right now. We've been running testing since November of last year and have really just expanded our capacity to serve the community. As a point of comparison, we've got these 10 regional hubs in addition to our rapid response teams and the at-home testing kits. And LA Unified, which is much bigger than us, they've got 800,000 students. They have 11 testing locations across the entire district. And so are spread much more thin as compared to how concentrated our testing program has been. And then one of the last things that I will spend some time talking about is our contact tracing and case monitoring program. This is another area that we've really invested a lot of time in to make sure that it is really robust. We know we're still in this pandemic. We know that people are getting COVID and that there are many opportunities outside of the school day for people to potentially be in close contact to others who might have had COVID. And we want to make sure that we have the staff and the protocols to support people when there is a positive case. So for our families who are on the call, just know that, if you find out that you as a family member or that your child is positive, please notify your principal right away so that they can initiate the contact tracing process. So the contact tracing team will then follow up with an interview with the principal as well as with the positive individual and potentially other people like the classroom teacher in order to get the information that's required. And we've updated our contact tracing protocol based on the new CDC and CDPH guidelines so that we're asking information about when symptoms started, when their last day on campus was, who they were in close contact with, to try and get as much information as we can so that we can make sure that we're providing accurate information both to the positive individual as well as to the wider community. So at your school sites next year, if there is a positive case, there's 3 types of communication that will go out. The first is to the positive person themselves, notifying them of the quarantine guidance, how long they need to quarantine, and then when they will get a follow-up phone call at the end of the 10 days of quarantine from our contact tracing team to check on them, make sure they're okay. If they're a staff member, make sure that they understand what options they have for their leave during that time. There's also a communication that will go out to any prolonged close contacts. So if there was someone, multiple students, a class that was in prolonged close contact to that positive person, they will also all get notified to say, hey, there was a positive case. We have reason to believe you were in prolonged close contact. Here is what we are advising in terms of a quarantine or in terms of testing. And I will talk a little bit more about that in a second. And then the third notice is to the general school community to say, hey, we had a positive case at our school. We followed the protocol, we notified close contacts, and we are letting the entire school community know in the spirit of transparency. But if you did not get a prolonged close contact letter, there's no reason for you to quarantine. That being said, we will have testing on site. You are welcome to come get tested if you are concerned. The quarantine guidance will differ for individual prolonged close contacts based on vaccination status and based on masking compliance. And this is a big departure from the state as compared to their guidance from this spring. So one of the key changes is when there is a positive case and there are prolonged close contacts, students who are prolonged close contacts, We will be offering them testing on site 2 times a week for 2 weeks. And we'll say, you can come back to school following an exposure, but you have to get tested. You have to get tested twice a week for 2 weeks. We will provide that testing for you. Alternatively, if that makes a family nervous and they choose to quarantine for 10 days, that is certainly allowable. But the goal is to really minimize the amount of in and out and trying to account for childcare and also to also to prevent interruptions to the educational experience. So we want to, again, maximize access to testing and really provide it as quickly and as easily as possible when there is a case, so that staff, students, families don't have to work hard to get access to these testing resources when they find out that there was an exposure. Also, we will be updating our public dashboard about COVID cases, again, in the spirit of transparency, which I think it's really important for us to be in communication with our community and to be open about where we have seen positive cases throughout the community so that we can track that along with the work that the county is doing to track cases generally across the city and across Alameda County. So again, just to sort of summarize before we move into the last round of Q&A. So 1, masks are indoors. Masks are required indoors at all times for all staff, for all students, regardless of vaccination status. Reiterating that everyone must stay home if they have symptoms, again, regardless of vaccination status. If you have a new or different symptom that could be COVID related, you should stay home. We are requiring the daily health screener for staff, including contractors and volunteers. Access to that health screener is also available to families as well. We are asking that for our family members, please report all positive cases to your principal right away, because the sooner you're able to communicate to the school, the sooner we're able to begin the contact tracing process and advising the principal about what to do, communicating with the community, and getting testing in place. Our staff cases will go to our HR or talent department, and our student cases will go to the health services department to manage contact tracing. And then also what is required is that when we do provide quarantine guidance and testing guidance, this is what you need to do because you are in close contact, that you need to follow those instructions because those are public health guidelines. But also just want to reiterate that we are also at the point in the pandemic where there's a lot that all of us can do individually to collectively really move ourselves forward and towards the end of this pandemic. So some things that we can all do to keep our schools safe. Number 1, really top of the list, is to get vaccinated. There was a question earlier in the evening around if vaccines would be mandated for staff and for students. And the response is that as of right now, vaccines are not mandated. They are very strongly encouraged for all eligible staff and all eligible students. And we've been working with our local health care providers as well as with the county to provide vaccine pop-ups throughout the summer and over the course of this fall as well, to make sure that our staff and our students have access to the vaccine in their neighborhoods, at their community, so that they don't have to work too hard to get access to the vaccine. That could change. Again, all of this guidance could change tomorrow, depending on what the state public health department or the county public health department says. It's still very much an evolving situation. We wanted to provide access tonight to the latest information that we have, because we know that people are genuinely anxious and concerned and worried about coming back in person at the same time as they are, excited to be back in person and excited to have their kids back with their friends and with their teachers on campus. And so this is the best information that we have as of today. And if the guidance does change again in the next few weeks, we will obviously then update everyone again. So going back to the last few things that we can all do to keep our school safe: getting vaccinated, wearing a mask indoors, not just at school, which is required, but really anywhere that you're going out. If you're in crowds outdoors, if you're going into another indoor location, wearing a mask can help reduce the spread. Staying home when you're sick, again, not just staying home from school, which is a requirement, but from other activities as well, right? To just reduce community transmission. Washing your hands, keeping yourself as healthy as possible, not just from COVID, but from other things as well. Making sure that you get COVID tested if you have symptoms, if you've been exposed, or if you're unvaccinated. And again, testing is available at our 10 regional hubs. Also, at-home kits are going to be available at every school site. And then please do notify your school if there is a positive case in your family. And then last thing I'll say before we go back to questions is we've put up these QR codes that goes to a form. It's in multiple languages that comes to me as well as to Rebecca Littlejohn, who's our risk management officer. If you have any concerns at your school site that can't be resolved at the school site. So if you've had a conversation with the principal, if you have questions about COVID safety, around cleanliness at the school site, around just general campus safety, please do let us know. I know that there were a couple of questions in the chat as well around general school cleanliness. I will just mention as an aside, that's something that we are continuing to work on with our custodial team. They are investing in a new pilot program this year called Restroom Alert, where staff members on campus can actually notify immediately both the custodian as well as the custodial services department if there's an issue that needs attention, like replacing the toilet paper, or that there was a spill, or that there's something that needs attending to, so that there can be more real-time visibility into any kind of cleanliness issues that exist on site. And so we're really excited about that and really hopeful that it will work in service of our school communities, and it'll address some of the longstanding issues that we've had. So Jody, you want to go back to see if there's any other questions?
Yes, quite a few. Thank you so much, Selja. Trying to group some together. So first, if you could share, there's some questions about if a child has a symptom or they're sick but do not have COVID. So how long do they need to stay home in that case? And what do they need to do to come back? Do they have to get tested, for example?
Yeah, that's a great question. So if a student has symptoms and you're not sure what it is, there's basically 3 ways back to school. One is to quarantine for the full 10 days. 2, it's to ensure that their symptoms are improving and that they don't have a fever and they get a negative COVID test. And then the 3rd way is, again, making sure that their symptoms are improving, that they don't have a fever, and they get a note from their healthcare provider that says, this isn't COVID, this is allergies, or this is asthma, or this is something else. So any one of those 3 ways will allow the child to come back to school if they do have symptoms.
Thank you. So the next set of questions are if the child does have a positive test or goes into quarantine, will they have access to Zoom school? Do they have to enroll in distance learning? And if they do so, will they be able to come back to their home school, or will they be counted absent? So basically, what's happening in terms of school when they're quarantining?
Yeah, that's a great question. So if a child is directed to quarantine because they were positive, or they have symptoms, or they were in close contact, we are essentially treating that the same way we would treat any other kind of excused absence, right? The child was ill because of the flu. The child was ill because of a personal medical issue or a personal family issue. And so the teacher or the school would support that family in getting access to the work that they would have otherwise missed in class. We are not forcing anyone to enroll in the distance learning program, in the independent study program. That is there as an option for anyone who would like to choose that as their school program for the year, but there's not going to be an in and out just because of quarantines.
Thank you. And then what is in the protocols or in the guidance? What does it take to close a school down, or when would that be an option, or when would that happen if it will?
Yeah, that's a great question. And it's a good question, particularly because the guidance is different from the spring as compared to this fall. So the state essentially defines two different kinds of outbreak levels. So one at 3 cases at a site within a 2-week period as an outbreak, and one as 20 cases at a site in a 2-week period. And essentially what happens is when we are seeing multiple cases at a school site, we are working with Alameda County Public Health Department, and we've established a really strong partnership with them over the course of the past year, so that when we're seeing cases, we are in touch with their contact tracing team. And their focus is really on outbreaks and preventing outbreaks. And the key thing that they look for when they do their contact tracing process is to see if the cases are epidemiologically linked, which is to say, do they think that they're actually related? Or do they think that these 3 people got COVID from 3 different places, right? Maybe it's 3 kids who were in 3 different grade levels who had no opportunity to mix on campus. That would be treated really differently by the county than 3 kids who were in the same classroom. And so the advice from the county around that, around whether we should close the classroom or close the school, would likely be really different. So there's going to be a lot of just real-time support that will be happening for school communities and principals, and a lot of real-time communication with the county as well, every time there's a positive case.
Thank you. And if you could describe a bit of prolonged close contact, because you saw that's impacting whether or not folks would have to quarantine, just say a little bit more about what that means. If it's not defined, what is OUSD thinking about it?
Yeah, that is actually one of the terms that is defined for us. And so prolonged close contact means closer than 6 feet for longer than 15 minutes in a 24-hour period, regardless of vaccination status and regardless of masking. The advice around quarantining does differ based on mask status and vaccination status, but the definition of prolonged close contact is closer than 6 feet for longer than 15 minutes.
Great. And then would there be any enforcing or trying to do some social distancing? And if so, how to monitor that, even if it's not the current guidance?
Yeah, it is really interesting that the physical distancing requirements were completely removed by the state. And, you know, sort of the timeline was the CDC released their guidance, and then the state released their guidance shortly thereafter, and really positioned their guidance as, we're going to look at what the science says. We're going to look at what happened in school reopenings, which happened pre-vaccine, in order to determine the guidance for this year. So really going hard around masking indoors, but not so much physical distancing, because they did see that there were school districts that were able to successfully reopen last year without those physical distancing requirements in place. So certainly physical distancing is not a bad thing. As Dr. Frank showed, you know, the more layers you have, the better, but it's not something that we're going to be enforcing the way that we did in the spring in every single one of our classrooms.
Thank you. And then with the COVID testing, will the students be able to take the test at home or at school? And how will they get access to those? When would they do one or the other?
Sure. So the at-home test kits are designed for use at home, that those would be sent home with families if there were symptoms, if there's someone who's unvaccinated, if there was a prolonged close contact situation, again, just so for ease of access for the family. Testing would happen on site when there was a case, and we would send our rapid response team to the site to provide testing right away to both the individuals who might have been in the prolonged close contact category, as well as anyone else on staff or who was on site who wanted access.
Great, thank you. Another question is with the daily health screening, I think you mentioned, but there's some clarifying question or just some questions again. Will that take place this year? Will students still have to log in and show their daily health screening on Parent Square?
Mhm. Yeah, so that functionality is still available in Parent Square. We are not turning it off. And so it is certainly a great way for parents to remember to check for symptoms each day. We're not going to exclude students from school just because they didn't fill out their health screener. However, for staff, it is actually a requirement for all employees from the state. So that is something that is absolutely mandated for staff.
Okay. And then just to clarify again around the distance learning option and how we are, I know we're trying to get more information out to staff in future communication or to staff and to families, but what kind of resources are going into the distance learning? That's one part. And then if you can clarify again, if that is always a choice or if there's any point in time, like a number of days past quarantine that the students will be asked to go to distance learning, or if it's only choice.
Yeah, so I'll answer the second question first, and then I'll pass it off to Gary Middleton, who's our Director of Alternative Education, to answer the questions about the program for distance learning. So to the second question of, will we be requiring participation in distance learning if the quarantine lasts a long time? Again, we won't be mandating distance learning for any of our students. We are treating absences because of quarantines the same way we would treat absences in a normal year, which is working with the student, working with the teacher to make sure that the student has what they need to make up that learning that happened in those days of quarantine. Gary. So Gary, I don't know if you're there to be able to answer the question about distance learning. There you are.
And just a reminder of the question, if you heard it, the question was, what resources is the district doing to support the distance learning option?
Well, what we're doing currently is we once we receive the state guidance from AB 130, we put together a team that is supporting the Sojourner Truth Independent Studies program, and we're currently putting together that program, and it will definitely be very similar to in-person learning. Will include synchronous and asynchronous time, but right now that's the information we have. We're currently going to work on an information session that we will host next week, and we'll be able to answer a lot more questions at that time.
Great, thank you, Gary. Other questions coming in, back to Salaja or others on the call. What support, these are related to masks. What support will there be for young children in keeping on masks? And then also if a child has asthma or some other thing, can they wear a shield instead of masks?
Yeah, those are great questions. Yeah, I mean, a lot around the masking, particularly for young children, is around teaching and normalizing the behavior. Some have likened it to, teaching young children how to get accustomed to wearing glasses, or as my 8-year-old just started doing, wearing a retainer, that these are, not necessarily comfortable things, but they are things that young children can learn how to do. And then the second question around the face shields. So if students or staff wish to wear a face shield, they also need to wear a mask under the face shield, or they need to have a face shield with a drape. Because again, what we're looking for in terms of masking is preventing transmission of aerosols to or from. And so we need that full coverage to really make sure that nothing is coming to or from the nose and the mouth.
Great, thank you. All right. Another question about understanding, we've reiterated that the vaccines aren't mandated for staff. We also talked about whether it would be public, individual staff members be vaccinated or not. And the answer was no, I believe. You can clarify that. And so there was a follow-up question if we would be able to make public percentages of vaccination among our staff, either at schools or in general.
That is not currently the plan to make public percentages. I know that there are other private employers that have done that around the state, but it is currently not our intention to do so and to keep that data as private as possible across all levels of the organization.
Okay, thank you. And I have a question here, actually more of a comment. There are several questions, and thank you, parents and community members, for posting these about specific questions for your school site of wanting to know the bell schedule, the start of the day, registration days, who your specific child's teacher is, the lunch menu at your school, if you have a uniform, where to get backpacks. And so that kind of information we won't be sharing here because each school has slightly different information based on the needs of their school community. And so we did, and we'll put in the chat again, a communication list for all of the schools so that you have the contact information for your school. And I did see some comments saying that you have contacted your school and still haven't heard back. And so thank you so much for that feedback, and we can support in making sure that schools are reaching out to all parents so that everyone has that information. So I also want to say, I also see some folks saying, how come you haven't answered my question yet? We currently see 360 questions coming in. And so we're trying to answer as many as possible. And we can take a few more before the close of this meeting, but we will save all of the questions in the Q&A and in the chat on the YouTube live stream to inform our future communications. So let's see. Let me see if let me take just a few questions of folks whose hands are up to close out our time. I'll take a couple people there. So Maria, go ahead, and you should be able to unmute yourself and ask your question or say your comment. Let me try one more time. Okay. Maria, go ahead, unmute yourself. There's Maria Harugui.
Hola.
Yes, we can hear you.
Bueno, yo tenía varias preguntas al inicio porque no pude activar nunca el traductor. He entendido muy poco, pero creo que se está tratando solo de lo del COVID. No está diciendo como los niños que apenas van a ingresar a TK, bueno, no a kindergarten y cosas así, ¿verdad?
Yes. So the question was, she was saying here that at first she just had some questions about accessing interpretation. And then also she's understanding that a lot of information tonight is around COVID and there's not specific answers about entering TK classrooms. And yes, that's correct. So, and I'm not sure if you're hearing interpretation right now, but sí, tiene razón, estás correcto, en la información es más de COVID y información específica de su niño o de TK, programas de TK, vamos a poner los números de contacto por esa información. So thank you, Maria. Let's go to Pierce family. You can unmute yourself and ask your question or share your comment.
No question at this time. Thank you. I think you guys are doing a good job.
Okay, thank you so much. Let's go to Sydney Lowe. I'll try again. Sydney, go ahead. You can unmute yourself. I think maybe we left her, or Sydney lost her. How about Dikla Dolev? Dikla Dolev, you can unmute yourself and share your question or comment. as well. Okay, let's take one more person and then we will close for the evening. Let's do Nashwa Imam. Do you have a question or comment? Nashwa?
No.
Okay, sometimes that happens. All right, well, thank you, everybody. Sorry we couldn't answer, and if you were waiting for your particular question to be answered and we did not get to it this evening, we will have another meeting, the same information, but we can take more questions tomorrow evening, same time, so you can join again. You can tell friends and other family members to join tomorrow, same time, 5:30 to 6:45. We'll review the questions we have tonight and share that information. We are recording this presentation, and we will record tomorrow night's presentation as well and post those. So if you're not able to hear, or you can see different questions answered. And again, we will read all of the questions that were submitted to inform our future communications to families. So with that, we will close our meeting, and thank you so much for attending tonight. And please continue to send in your questions to your school sites and to the district email site, and we will post things on our website and send future information. Thank you so much.